year, all I got was shrugs of the shoulders, and the problem was alleviated within 1 hour. Okay, why is the bureaucracy not addressed to, as opposed to cutting benefits to seniors, okay, or cutting benefits to providers?
Okay, what's your name?
My name is Dr. Lewiston, and I will go with you to Washington.
I am, Dr. Benjamin, I appreciate it. Look, let me deal with your second part because it's a little easier and not as emotional. The fact is, you're absolutely right. We get calls in our office all the time from people, from providers who can't get reimbursed, from individuals who have issues. They need us to get involved to help with Medicare. There are lots of ways. You talk about saving money. There are lots of ways to save money. You've hit on one at Medicare. You start pre-authorizing some of the providers as well. You're going to eliminate fraud. There are a whole host of ways that we can save money in Medicare and make it easier for you to do your job at the imaging center and for patients to get treatment. And listen, let me talk about the health care bill. You're exactly right. And a lot of people have talked about messaging and politics and right. The health care, the Affordable Care Act. I mean, I know people are all exercised over the individual mandate, and we can talk about that, whether it's constitutional or not. I understand that there are some legitimate issues that businesses have that they want to make sure that it doesn't impact it doesn't cost too much, or that some of the paperwork they need some help with. I get that. We get those calls in our office. We deal with them, and it's not perfect, and there's going to have to be work done to it. But on the fundamental issue, I talked earlier about trying to level the playing field. You can't be denied coverage because of a pre-existing condition anymore. You can't have your policy canceled just because you got sick, which was happening all over this country. People paid year after year after year after year. Then they needed it, and the insurance company canceled the policy. This is not. We talk a lot about politics, but so many of the things that really matter in the Affordable Care Act are really just about people. And Dr. Benjamin, I appreciate your coming here. Let us get your information. I'd love to find a way for you. This happened on the 1-year anniversary. We were trying on the 1-year anniversary of the. And I'm sorry to ramble, but I feel really passionate about it because you're exactly right.
Marco Rubio wanted to meet me last year. Wanted money. I'm
right.
I'm not ashamed to say that. Okay? He wanted to meet me, and I told my partner team at the center, if you need him, I refuse to meet him. On the 1 year, listen. On the 1-year anniversary of the Affordable Care Act, I went to the floor of the House, and I didn't know you at the time. I'll add you to my list. I told the story about a very dear friend of mine whose son was born with a heart condition. He's had 8 surgeries. He's 7 years old. He's had 8 major surgeries. And it looks like he might be okay. And before the Affordable Care Act, if this little guy grows up, gets a job, loses the job, leaves the job, forget about it. He never would have been able to get insurance the rest of his life. He would have been always one step away from losing everything just because he was born with a heart condition that needed some surgery. Same thing for people who have had cancer and survived. Same thing for people with other diseases. I understand this has been a big hot-button issue. Ultimately, though, I appreciate your being here. There are an awful lot of people whose lives are a lot better off. And I know some people are uncomfortable hearing that, whose lives are a lot better off because the Affordable Care Act passed. Thank you.